In the talk, we will go over several examples of blood biomarkers, imaging biomarkers, which can guide whether nutrition is effective or not. For example, my group has invested in studying the delivery of omega-3s into the brain, and we're developing PET scans to look at brain omega-3 uptake. We ask the question, do, for example, ApoE4 carriers have lower omega-3s in their brain, and how can you find out? With these imaging modalities, you can actually look at the turnover of omega-3 in the brain using PET scans, then do perhaps a supplementation intervention and re-image the brain and find out if omega-3s have entered efficiently into the brain, remodeled into neuronal membranes, decades before any cognitive decline is seen because of this latency time, a long lag time between a supplementation or a dietary intervention and disease onset. So these imaging biomarkers, whether you're looking at brain lipid uptake or you're looking at atrophy, for example, in a European trial known as a lipid diet, they found out that a nutrient combination known as Fortisant Connect was able to slow down atrophy in the regions that are affected in Alzheimer's, such as hippocampal volumes. And that change on the hippocampal volumes was evident before the change in cognitive outcomes. So brain imaging could play a role. Blood biomarkers can play a role. For example, you could measure levels of omega-3s, like the omega-3 red blood cell index, or levels of vitamins such as B12 or homocysteine, and use those as intermediates to see if the dietary intervention is effective before you look at hard outcomes, which happen much later and require bigger sample sizes to see effects. So ultimately, biomarkers are critical to guide nutritional interventions.